This surgical video demonstrates the placement of the Pitt Easy Implant System. The Pitt Easy Implant combines the properties of a tapered implant body with the advantages of a self-tapping expansion thread system. The unique implant design allows for superior primary stability in all types of bone quality and is available with a vacuum titanium plasma spray surface and a nanostructured surface called PureTex. This patient is a 58-year-old female missing teeth numbers 12, 13, 14, and 15, the upper first and second left premolars and molars. The panoramic X-ray shows the edentulous left maxillary segment with adequate bone for implant placement. The clinical preoperative photo illustrates adequate facial lingual dimension of the alveolar ridge. A diagnostic wax-up was performed to fabricate a surgical template to guide the implant placement. The surgical implant defines the incisal boundary as well as the facial boundary of the future prosthesis. A mucoperiosteal flap was planned to gain access to the crestal bone. A crestal incision is made to allow access via a full-thickness reflection. A periosteal elevator is used to elevate the flap. The surgical template is tried in to verify the landmarks for implant placement and evaluate intraorally the proper implant angulation. The first step towards preparing the osteotomy is to perforate the crest of the bone with the initial perforation or IP drill at a recommended speed of 1000 RPM. Ideal angulation of the IP drill is perpendicular to the plane of occlusion in the proper crestal position as determined by the diagnostic wax-up and subsequent surgical guide fabrication. The osteotomy commences with a 2 mm twist drill, again at a drill speed of 1000 RPM, and will be carried to the full depth of the planned osteotomy. In this case, the full depth is 10 mm. The orientation of the twist drill is important as it will determine the orientation of the implant to be placed. Once the initial osteotomy is prepared, the depth can be verified with the depth gauge. The depth gauge has length graduations starting at 8 mm and continues in 2 mm increments. At this time, the thinner 2 mm half of the paralleling pin is placed into each osteotomy to determine the alignment with adjacent teeth and the proper occlusion is verified at this stage. A radiograph is recommended at this point. The coronal aspect of the osteotomy is now widened from 2 mm to 3 mm with the 2 caliber drill at a drill speed of 1000 RPM. The widening of the coronal part of the osteotomy allows adequate access for the following final precision drills. Each Pitt Easy implant has its own color-coded precision drill for the final preparation of the osteotomy. To reduce trauma, allow for maximum cooling, and exact drill orientation, it is recommended to progressively widen the osteotomy with a sequence of inferior diameter precision drills. Since we are placing 2 Pitt Easy implants of 4 mm diameter in site number 12 and a 4.9 mm diameter Pitt Easy implant in site number 14, we continue to widen the osteotomy with the 3.25 mm final precision drill, color-coded with a green ring, to the full depth of 10 mm. The bone quality determines the further preparation of the osteotomy. In bone quality D1 and D2, it is recommended to insert each required drill to the full depth. With the unique Pitt Easy implant design, A superior primary stability can also be achieved in bone quality D3 and D4 by modifying the drill insertion depth. In bone quality D3 and D4, it is recommended to insert the final precision drill only 1/3 of the required depth, and the final precision drill before that to 2/3 of the required depth. This stepped approach allows the clinician to achieve superior primary stability independent of the bone quality. In this case, the bone quality in both sites has been identified as type D3. In site number 12, a 4.0 mm by 10 mm Pitt-Easy implant is planned, and in site number 14, a 4.9 mm by 10 mm Pitt-Easy implant will be placed. For this reason, the next final precision drill of 3.75 mm, color-coded with a yellow ring, is inserted in osteotomy site number 12 only to 2/3 of the full 10 mm length. The osteotomy site number 14, on the other hand, is consequently widened with a 3.75 mm final precision drill to the full length of 10 mm to accommodate a 4.9 mm implant. The osteotomy site number 12 is now widened to the final diameter of 4.0 with the final precision drill, color-coded in red, but only to 1/3 of its 10 mm depth. The drilling protocol for softer bone applies in this case to allow for higher initial stability of the implants at time of placement. To finalize the osteotomy at site number 14, the 4.0 mm final precision drill is inserted to the full length, followed by the 4.25 mm interspace drill, which is color-coded in blue and white and is inserted to 2/3 of the full length. This is followed by the 4.9 mm final precision drill extended only to 1/3 of the full length. Throughout the osteotomy preparation, copious irrigation is applied in conjunction with relatively low speed of 1,000 RPM to ensure gentle preparation and minimal thermal injury to the osseous structure. It is recommended to flush the prepared osteotomy site of all bone debris with copious sterile irrigation. As the site refills with blood, the implant is removed from its color-coded sterile vial and carried to the site. As the Pitt-Easy implant moistens with blood, the proper insertion angulation is confirmed and the implant is inserted with clockwise rotations using the plastic carrier and finger pressure.